Hi, this is Pam. The video today, or the topic today, is how parasites cause inflammation and immune dysfunction and how to treat them effectively. So if we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And the reason I like talking about this is, number one, I have recovered from multiple sclerosis over 30 years ago. And so there is hope for everyone if you're living with chronic disease. And our approach is very different with Live Disease Free. What we're helping you to do is to really focus on the cause. What is causing your disease? And the topic today is really important because last week we talked about inflammation and what inflammation is, and hopefully you remember what you learned. So inflammation is the war. It's the war between your immune cells, your immune system, and different types of parasites and the toxins they produce. So we know that all diseases are inflammatory conditions. And so today we are going to talk a little bit more about how these parasites cause inflammation in our body. And of course, I saw one little comment that we want to know how to treat them effectively. So I do share that on a lot of different videos. I will talk about that at the end also. So the whole purpose of learning this is because we have to understand our starting point. If we want to recover from chronic diseases, we have to understand what is causing our disease. We have to understand what is going on in the body. And if we understand that we're dealing with a parasitic infestation, and we understand the toxins and the parasites are causing the inflammation, they're causing this inflammatory condition, then we understand what we have to do to recover. Then we can follow the Live Disease-Free steps. I just want to make sure you guys can hear me. I do not see people here yet. Hopefully it is working today. Let's just see. I'm just going to carry on because it looks like it is working. But for some reason, there must be a lag with you guys showing up. So hopefully, what I'd like you to do is, if you come late, just make sure you type your questions in the question box. So again, today the topic is, how do these parasites cause the inflammation and the immune dysfunction? So there are many different ways. We're going to just focus on a few because I don't want to overwhelm you with the science. But if we just look at, for example, there's one doctor that I found really, really helpful years ago, Dr. Alex Vasquez, and he's a chiropractor and a naturopathic physician. He also teaches functional medicine courses at universities. And so he was talking about dysbiosis a long time ago. And I'm going to take one moment and check because I don't see comments here. So I just want to make sure that you guys can see me or hear me. Make sure to type in your comments. I'm just going to do a quick check on Facebook to make sure that I am broadcasting live, because normally people are on before. I don't see it. That is peculiar. Okay, I am going to restart the stream. Oh, there we go. You can hear me. Okay. I guess there was a bit of a delay. I don't see it on Facebook, so hopefully it will be there shortly. Okay. Very strange. I don't know what is going on with Facebook, but we'll see. All right, I'm just going to carry on. And if you join late, you'll just have to listen to the replay. So when we have, with our doctors, the reason it's so difficult for our doctors to identify these parasites is, number one, they're told that we do not have parasites in developed countries. You have to travel to a third world country to have a parasite. Number two, we call these parasitic infections chronic silent infections in the body. And our doctors don't have good tests to pick this up. So they don't have good tests. They are able to detect acute infections that we have. So if we go in with strep throat or tonsillitis or bronchitis or stomach pain or a sore tooth to the dentist, earaches, ear infections, bladder infections, all of those types of infections, our doctors know what to do. They have tests. They are able to look for fever. They're able to look for swelling and for redness and things like that. And so they're able to diagnose acute infections where we have fever and redness and swelling and pain. But for these chronic parasitic infections, they don't have the tools or the skills to pick them up. And I believe that this, unfortunately, has been fairly intentional, because if we treat parasites, we lose a customer. If we put them on immunosuppressive drugs for the rest of their life, we have a customer for life, paying the insurance companies usually for very large sums of money every year, upwards of at least $100,000 for some of the newer MS drugs. So I'm not faulting the doctors. I'm not faulting any of our practitioners. They know what they know, right? And whatever they don't know, they haven't learned. So the term dysbiosis, which I talk about in previous videos, it's important to just talk about a couple of terms so that you understand what I'm talking about. So dysbiosis means we're out of balance. We have too many disease-causing microbes and not enough health-promoting microbes. And when we have this, our immune system is no longer able to defend us. So this I've shared in other videos. It's usually the biggest cause is antibiotic overuse. So that's usually the biggest cause of the dysbiosis. So we have too many disease-causing microbes and not enough health-promoting microbes. And it's fascinating that this term was coined or established in 1903, dating back to 1903. But it kind of didn't get a lot of attention until 1985. And I just wanted to share a quote from Dr. Vasquez. So there are a small number of hero doctors that understand these parasitic infections. And one of them is Dr. Alex Vasquez, and he teaches about dysbiosis. He teaches about these silent infections, these parasites, to different institutions. So he shared a quote. He shared, "In my own clinical practice, gastrointestinal dysbiosis is so common in patients with autoimmune and inflammatory disorders that I consider all of these patients to have dysbiosis until proven otherwise." So I think that you guys are on YouTube, but for some reason, I think Facebook is not connected. He also shared, "My experience is consistent with that of other authors and researchers who note a prevalence of dysbiosis in the range of 70 to 100% of patients with inflammatory disorders." Honestly, it's 100%, but they're not always able to detect it with tests. So all disease are inflammatory conditions, and they're able to detect dysbiosis, or too many disease-causing microbes and not enough health-promoting microbes, in 70 to 100% of their patients that have any type of inflammatory condition. So let's now talk about the ways that what I might do quickly here. Sorry for the disruption. I just know that there are a lot of people waiting over at Facebook. What I'm going to do is just quickly invite them over here. Let's see here. Oops, there we go. All right. So the ways, and I won't talk about all of the ways because there are a lot of ways, but what I'm going to share with you, you're going to get a very good idea of how these parasites make you so sick when we don't have an acute infection. The doctors are not able to pick up an acute infection. So number one, this is not exhaustive list. There's many other ways, but they can actually hide from our immune cells. So they have certain genes that they turn on and off, which would produce proteins on their surface. And so if they can turn them off and on quickly, then they can actually hide from our immune cells. And that allows them to, this would be, let's say for malaria, to infect our red blood cells. And we know Babesia is another protist which really impacts multiple sclerosis. So this process allows the parasites to travel undetected as they move between red blood cells, and which then makes basically they evade our immune system. And so this is where they are switching on and off proteins inside of the nucleus. So the the production of these proteins, and that alters those proteins on the surface of the parasites so they can actually confuse our immune cells, and our immune cells no longer can detect them. Another way that they cause immune dysfunction and inflammation, they produce superantigens. What I'm going to do is I'm going to put all of this on a blog post on our website, Live Disease Free. It's going to be posted tomorrow. We have a newsletter that comes out every week, and I share the video, the replay of this video, and I also share if you want to see it written, you can see it there, like all the references, etc. So you can review this yourself. So the superantigens are produced by bacteria and fungi, and antigen just means like a foreign substance. So they produce these foreign substances, molecules that really trigger our immune system to react like there's an enemy. So it's not always just the infections, but it's also the poisons they produce. So they also produce, so we'll talk about gram-positive bacteria. The gram-positive bacteria can produce certain molecules. And what I mean by gram-positive and gram-negative, if you are identifying bacteria, it's like how they stain. So for example, strep bacteria can produce different toxins that make us feel really sick, cause a fever. We can have skin rashes, lesions, inflammation of different tissues, including tendons and arthritis. Certain staph bacteria, so those would be gram-positive also, can produce toxic shock syndrome. It's a poison that causes scalded skin syndrome, and also just the bacteria can produce toxic shock syndrome and food poisoning. And there are other so those would be exotoxins. So those are toxins that are produced, they're released by the bacteria, whether it's strep or staph. Then there are other endotoxins, which are on the surface of bacteria, and they also will trigger pro-inflammatory, similar to what we would see in sepsis, and where we can also have increased permeability, like leaky gut. So the toxins, they can cause leaky gut and can also inhibit our liver's ability to detoxify, also disrupting the blood-brain barrier. I've talked about this on a few other research studies where certain bacteria in the gut can produce really strong neurotoxins, and they were found in MS patients. And those neurotoxins, they will cause our blood-brain barrier to be compromised. And what happens, we'll talk more about what happens then, but we know that our blood is not sterile. We know that our central nervous system is not sterile. And if we have a compromised blood-brain barrier, then a lot of things that are in our bloodstream that shouldn't be there will cross into our central nervous system. Then there is also another situation where certain molecules from the different parasites, they can bind to our human molecules and produce a new hybrid molecule, which our immune system will attack. I'm trying to simplify the language so that you understand it. Biology has a lot of big words, but basically it's a molecule produced by the different, whether it's a bacteria or yeast, etc., and they will bind to a human molecule and make this new, combined molecule, and our immune system will not recognize it as self and can attack. So there are different ways that potentially could cause short-term autoimmunity. I don't believe it's long-term, because when we treat these infections, we don't have these symptoms anymore. But if there are molecules that are part self and part bacteria or yeast, that could be a problem for sure. They also damage the lining of the intestines, causing, I talked about leaky gut. So when we have leaky gut, we get an absorption. So a lot of things that should not cross from our intestines into our blood do. So that could be undigested food. It could be different pathogens like bacteria and fungi. It could be poisons that they produce. So they all end up in the blood, and then our immune system causes a very strong alarm, right? Because our immune system is like, oh my gosh, there's all this stuff in the blood that we have to take care of. So this is an overstimulation of the immune system. And this is seen in a lot of different kinds of diseases, for example, with asthma, eczema, psoriasis, different conditions that are part of inflammation of the spinal cord, also inflammation of joints and lupus. We talked about the damage to the blood-brain barrier, and that causes inflammation in our central nervous system, which we see in all kinds of neurological diseases, including MS. Inhibition of detoxification. So basically, as the toxins, so as the populations of these infections increase, we have more toxins from them, and that can cause systemic inflammation and immunodysregulation or immune dysfunction. And also just our body's not able to deal with the toxins, and that's why we're in a constant state of inflammation. Anti-metabolites, so these are molecules produced by yeast and bacteria that can jam up or wrench or otherwise interfere with the normal cellular metabolism. So like how our body will normally operate as far as, digestion and the production of energy and all kinds. We have production of hormones, and our body is so incredibly complex. So the bacteria and yeast, if they become really populated, and with this dysbiosis, it's not just dysbiosis of the gut, it's also dysbiosis which is found in it can be any part of our body. So being out of balance with our microbes, having these chronic infections, it could be orally, it could be in our reproductive tract, in our digestive tract, in our respiratory tract, in our tissues, in our organs, in our central nervous system. So wherever these bacteria or parasites set up camp, this is where we are going to find that we have the dysbiosis, and where we can have increased molecules, toxic molecules produced, and it can interfere with the way our body normally operates. And then the impairment of mucosal and systemic defenses. So this is where sometimes we can end up with impaired production of antibodies. So if we don't have as many antibodies produced, or we can have direct tissue damage. So when we have the inflammation, let's say if we have worms or bacterial infections or yeast, we can have direct damage to different, like can be the mucosa, it could be our skin exterior, it can be our blood vessels, it can be the lining of the digestive tract. So that can be directly from infection. We can also have the, as I mentioned, decreased production of antibodies. I shared on my masterclass training how these microbes can produce enzymes that act as Pac-Man, and they actually eat our antibodies, so that can directly suppress our immune system. And then also the big one for us, the biggest base camp where the biggest problem is, where it starts, is in our digestive tract. And this is where the impairment of the mucosal digestion by microbial proteases and inflammation. So the microbes, as I mentioned, they can produce these enzymes, which are proteins, and so they can just directly destroy or harm, degrade the lining of the digestive tract, but they can also cause us to have less digestive enzymes. So what we see a lot with people that have chronic disease, they have these inflammatory conditions, it is that they don't digest carbohydrates well. So we can have these microbes will produce enzymes that can actually damage the production or reduce the production of enzymes that help us to digest carbohydrates, so complex carbs. And when we don't digest the complex carbohydrates, then they end up going down lower into our digestive tract, into our small and large intestines, and it feeds the infections there. So we end up feeding the infections, and we can have malabsorption, malnutrition. So that's why so it's number one, we decrease the carbs in recovery because, number one, that's the perfect food for these infections, but also a lot of us are not digesting our carbs well because our digestive tract is compromised from these infections directly and by what they produce. So, and also it says also inflammation that results from intestinal dysbiosis also further impairs carbohydrate digestion by down-regulating carb enzyme gene expression by inflammatory cytokines. So when we have the infections, we have a lot of inflammation. So it's not just that they're producing enzymes that decrease our enzymes that digest the carbs, but also just the presence of so many cytokines, which are our immune molecules present, that can also cause the downregulation. Let's see, is that what? Yeah, downregulation of our genes to produce enzymes that help us digest carbohydrates. So hopefully you understood that. So it's the overregulation, it's the overinflammation that we call it a cytokine storm. I'm trying to keep it really simple, but there's these molecules that our immune system produces, and they're called cytokines. And if it's kind of like, it's really important part of our defense. But if we end up with this chronic infection for long periods of time, we can end up with overexpression of our immune system. So we get these cytokine storms, and that can directly downregulate the production of enzymes that we need to produce or to digest our carbohydrates. So it's not just that the carbs feed the infections, but it is also that so it's not just that the carbs feed the infections, but it's also that we don't digest them because of, number one, a breakdown of where the enzymes are produced, but also because of our immune response. So there's various ways why we don't tolerate carbs very well. And then, so we talked about it causes malabsorption, maldigestion, and so we're having increased absorption of molecules that should not go into our blood. And that perpetuates this inflammation because our immune system is constantly, like our digestive tract is compromised, things are getting through. The microvilli, I don't know if you've ever heard of those before, but there's like these little finger projections along our intestines, and that really increases the surface area for absorption. They become damaged. We have a breakdown of the intestinal wall, so a lot of food, microbes, things are going through that shouldn't go through, toxins, and our immune system is chronically overstimulated in that area. And then the last thing, I've talked about biofilm formation. So biofilm is where these microbes, they produce a slimy tent coating where they hide under. This is very well known. I've shared it on my masterclass training. It's with Lyme, it's with yeast, candida, and all kinds of microbes. This is what makes it hard to treat them. And this is why we have to consider this when we are recovering. So the fourth and final, bacterial proteases, so the enzymes that break down protein that are produced by the bacteria, they work synergistically together with biofilm formation to nullify our immune attack, so basically suppressing our immune response. And it's really important for them to be able to establish themselves on our, when we say mucosal, that is just on our mucous membranes anywhere in the body. So that is one way they become very well established, is they produce this the biofilm that they hide under, and our immune cells cannot get at them, and our medications we're taking can't get at them, and so we have to treat the biofilm. But that also helps to perpetuate this immunosuppression and cytokine inactivation. So I tried to make it simple. It's kind of complicated, but what's so frustrating is that all of this information is available in science. This has been around for many, many years. I think Dr. Vasquez has been sharing, like what he's been doing is just kind of accumulating a lot of this information, and he teaches it in his courses. He's a professor that will teach a lot about dysbiosis and these chronic silent infections and how parasites, like how all of these chronic inflammatory conditions are caused by infections, parasitic infections. And we need to have a paradigm shift, like we need to switch away from our immune system attacking itself and really understanding. So there could be times where there's a combination of the enemy attaching itself to our soft tissue, where our soft tissue gets injured. But it's not that our immune system is just attacking healthy tissue, and it is not ongoing, because when you treat the parasites, we no longer have that. So this is why it's so important. And what I'd like to do is, for some reason, Facebook did not show up on the streaming. I think I'm going to have to use a different streaming source. I've had 3 weekends in a row with problems with this streaming platform, so I'm going to have to move to something different. But we do have a newsletter, And it is on, so what you do is if you want to get access to, like I always do a write-up and I share all the resources so you can look and see yourself, like all the document. You can share this with your doctors. You can share this with other groups, whether you have MS or a different disease. But the only way things are going to change is if others help me to get the word out with respect to really helping people to understand that we're dealing with infections. It's not a mystery. So I heard a doctor speaking today, and he was talking about a different topic. He was talking about what's going on, and I can't even talk about it right now, but the different infections that have been plaguing us for the last 2 years, or the infection, and then also a new one that's coming down the pipes. And he was saying, like, if people only knew what these big biology words meant, and they understood, we wouldn't fall for this. And it's the same thing with chronic disease. When we understand that inflammation is just caused by infection, that's by definition, and the poisons they produce, and then we see all these different ways that these infections have of hiding from our immune system, of causing our immune system to be, overstimulated, to cause like an overreaction, etc., like all these different ways, and how it goes into our blood, and how we get in stimulation into our central nervous system and leaky gut, and then all of this is just out there. And yet we still don't know what causes disease, and we still are not treating the infections because we have these immunosuppressive drugs. So the only way things are going to change is when we, the people, start to share this, start to talk about it, start to, like challenge our doctors and say, why are you not following this? And just say, like MS is an inflammatory condition, right? Yes, it is. Well, what's causing it? Well, we don't know. Well, what's the definition? What's the scientific definition of inflammation? And if they don't answer, you tell them. Like, this is what I pulled off of, this specific website, a scientific website. And so, like, why are we not looking for these infections? Why are we not looking, are you keeping up? Have you been looking to see, like, all the different studies that are showing dysbiosis in MS or different diseases? Are you up on that? Are you current on that? You'll probably make them fairly uncomfortable. But if you say it in a very nice, respectful manner, and if they're a good doctor, they will be like, you can say, well, if you haven't seen it, can I share some with you, right? And you can just share. I just did a dysbiosis video maybe a month ago, and I took literally less than 5 minutes. I did a Google search, but dysbiosis and MS, whole bunch of studies within the last 5 years, and this is exploding in science. And why are doctors not looking at this? Why do they not know this? So let's go to the how do we recover, because that's probably the biggest part of what you would like to know. So I've helped you to understand that we are not dealing with like one infection. Like if you have strep throat, you go to the doctor, you get an antibiotic, you take it for 2 weeks, and you're done. It doesn't work like that when you have chronic disease, because you're in a state of dysbiosis. So what we've seen in our students, we've supported over 1,000 students in the Live Disease-Free plan. We see a lot of worms, really big worms and small worms. We see protists. We don't see them, but that is what's showing up in the research. Things like Babesia, but other single-cell parasites. We also see bacterial infections. We also see things have been documented, like the Lyme infections. So some of them are protists, some of them are bacteria. And then for fungus, we've known for 30 years that mold and yeast can be different infections, usually, if not always, in different types of chronic diseases, including MS. So that's where we're starting from. We have a lot of inflammation. Our immune system is triggered constantly by these infections and the poisons they produce. And so we have to help it. We have to support it. We don't want to shut it down. But we have to understand there's not one pill that's going to kill a worm or a protist and a bacteria and a fungus. They're completely different microbes, different sizes. Some have cell membranes, some don't, etc., or cell walls, etc. So what we have to understand is our starting point. And because we're not digesting the carbs, as I shared, we really reduce the carbs because that's their favorite food and we're not digesting it well. That is the reason why we have to decrease the carbs. And when we do that, we notice a significant drop in inflammation and immune dysfunction. And we see a lot of symptom improvements, getting down to 35 to 40 total grams of carbs per day. or lower, maybe 30 for some people, they'll find that they feel better. So that's the first step. You cannot pop a pill and recover. Not that we have figured out yet. If we figure it out, we'll let you know. But the diet is the first step. It supports immune modulation. The second step is to support the body. This is where we're not going to start killing or treating the parasites, the worms, etc., unless we're having daily bowel movements, we're sleeping well every night. If you don't sleep, you won't heal. Cleaning up the environment of radiation, and also things like mold. Mold is a really big one that will make you sick and keep you sick. So we go through a checklist for healing where we're doing a lot of things to support our health. And here we are noticing that we have more symptom improvements. So people can have a lot of symptom improvements with the prep phase, which is the diet and supporting the body. Those are the two foundational steps if you want to recover from incurable diseases. If you just go straight to parasite drugs and fungal drugs and herbs, etc., and you're in this really strong state of inflammation, number one, you won't tolerate the treatments well, and they just don't work as well. Like, trust me, if we could still have our cheesecake and wine and chips, etc., and treat and be well, we would tell you, but we can't. So going low carb, supporting the body, and then getting ready to treat. And we use a layering. So we found the parasite drugs on their own are not enough. The antimicrobial herbs are not enough also. And also, so we're using an oxidizing agent, and we're using different types of antimicrobial herbs, but also the parasite drugs. So the herbs can be helpful for things like, especially if they're liposomal preparation for things like Lyme disease and knocking back other bacteria. We prefer them over antibiotics. But for fungus, if it's systemic, sometimes the antifungal drugs will help, but we're pulsing it, right? We're not taking long periods of time, but maybe 14 days of treating worms and protists, then 10 days of treating fungus, and then taking a break week. But during the break week, we will normally use herbs and or the oxidizing agent. And it's really sad, but I can't talk about the oxidizing agent here. I feel that I'm probably going to move very quickly over to Rumble. So if for some reason our videos disappear here, you can find me on Rumble. You can find us on our website, livediseasefree.com. We want to stay in touch with you. And also just make sure to go to livediseasefree.com, and just there's a little survey on the front page there right now that you can click on, and you can see if you have parasitic infections. It gives you some good questions that really help you to see, how out of balance you are with the microbes in your body. And then that way we'll be sending you our newsletter, which is once a week, where you get like all of the research, which you can share with other groups, and you can share. And we really encourage, because those of us that are recovered, we just don't want people to have to suffer like we did, and we want this to end. So when we get to the treatment part, we layer treatments and we do cycles. So if somebody is, let's say, just newly diagnosed, or maybe they have been sick for maybe a year or two, but they're still really highly functioning, they're still walking, maybe they can't work because maybe they have cognitive issues, or they're feeling tired and a little bit more weak, but they can still walk, etc. It might be that it might take 3 to 6 treatment cycles and you're fully recovered. For somebody who's had MS or another neurological disease for a long time, maybe you haven't walked for many years. What we're seeing with our students, maybe they've had it for 20 years or more, and they haven't walked for 7, 10 years. Those students, they could take up to 12 treatment cycles before they start to walk again. And when I say walk, it's not like walking. It's like using crutches, right? Building up their muscle, taking steps. So they have to build back their muscle because they haven't walked, they haven't used their leg muscles for a long period of time. But things like the drop foot, the ankles being locked, that will totally become soft again. People can move their ankle, they can walk heel to toe. The spasticity goes away, the balance comes back. But this is when the parasites are treated effectively, and it's not going to be just one that we know of at this point. Our students usually test well for 3 to 5 parasite drugs. The sooner we treat, the less parasite drugs we probably need. But they're usually 3 to 5 parasite drugs, and then at least a couple, 3 herbs, and the oxidizing agent. And it varies from person to person. And I have done videos on the different types of parasite drugs that are commonly prescribed, so you can look and see. So I can't give specific personal medical advice. I'm not a doctor, but what I can share with you is the general steps in what we take to recover. And when our students work with us, we help them to access practitioners for treatments. We help them to access the treatments, and we show them how to do it in a very safe way. And like I said, we've worked with over 1,000 students in 15 countries, so it doesn't matter where you live, we can help you. And we figured that out, which is so awesome. So I'm going to see if you have any questions, and I apologize. It looks like only YouTube is here. Awesome that you can hear me. Vasquez, is that the doctor family name? So his last name is, so he's not a medical doctor. I don't know if he's still in practice right now. I do know that he does a lot of education, and I'm sure that he has been teaching in functional medicine universities, and it is Alex Vasquez. What I'll do on our newsletter, I will have a link. He actually has some videos, and he has some different studies, so you can look at all of it, and it's really fascinating. It really confirms everything that we're doing and why the diet is so important and why it's so important to decrease inflammation for treatment, etc. Have you ever helped anyone with polio? Is it active polio? I don't know. All I can say is that all diseases are caused by microbes. So I believe polio is a virus. I apologize. I got the vaccine for polio when I was a child, but I know that the oxidizing agent that we work with, it treats viruses, so it treats everything. So yes, nowadays people shouldn't have polio, unless maybe it's in a third world country where they're trying to eradicate it, but there's a lot to that story I'm not even going to go into. But there are natural things that totally get rid of viruses. So if we have any kind of virus, whether it's hepatitis, whatever, follow all these steps. We want to build up our immune system. We want to support the body. We want to decrease the inflammation from all the other infections. So with any viruses, we usually find the viruses are more active when we're in a state of dysbiosis. And so if our microbes are in balance, if they're balanced, then usually our immune system will deal with viruses really well. So if somebody had any kind of virus, then number one, stop feeding the other critters. Viruses are not living, so they're not going to eat food, but all the bad bacteria, the disease-causing bacteria, fungi and worms and protists, they all thrive on carbohydrates. So decreasing the carbs, supporting the body, and then there are different therapies that we can use, especially natural ones for viruses. And what we found is that you're better off, even for, let's say, if you have Lyme disease. And if you had Lyme disease, you will be more successful when you treat the larger parasites first. So this would be for viruses too. You'll be more successful if you treat the larger parasites first, because they infect us with all kinds of smaller parasites, and then to deal with the smaller ones. And that is how it's a one system plan for everything, and that's how it works. And of course, we incorporate all of the healthy living as far as being active and, having the wellness champion mindset and really working on our mindset and cleaning up our environment and nurturing our soul and balancing our life. All those things are important, but really what everyone is missing is how to correct the microbes in our body, because that's what's directly causing our symptoms. So whether it is polio or any other issue, that would be the same. Yes, his name is Alex Vasquez. About polio, your mom now has post-polio syndrome. So Kate, I would say that, with your mom, if she has post-polio syndrome, then what I would do is I would really look at, and that's what we do in the academy, is really looking to see what other symptoms does she have. She likely has a lot of symptoms of dysbiosis, of different types of disease-causing parasites. And as she clears that up and as she supports her immune system, then if there is any remaining virus or whatever, that can be treated with oxidizing agents also. But you would never be able to clear a virus. So the viruses are the smallest infectious. Well, I'm not even going to say infectious because there's a lot of controversy going on about viruses right now, and I'm not going to get into it. But whatever a virus is we don't focus on them because they're the smallest of the problem. What we focus on the bigger parasites, treating them, restoring balance, and then if there is such a thing as a virus, then our immune system will deal with it because it's not overwhelmed anymore. It's not chronically overstimulated. It's not dealing with the inflammation and the immune dysfunction. So even things like the virus we've been dealing with for the past 2 years, some people can't overcome that. And so then what they do is they just correct their microbiome through all of the steps and then using oxidizing agents, and they just have lots of energy again very quickly. So I think that is Kevin sharing that he was almost disabled for 8 years, been working with Pam for 13 months and going strong. Awesome. Still improving. That is so great to hear. Thank you, Kevin, for sharing. So I saw a wonderful picture of him walking without his cane, which was so cool. That is why we do it. Maybe I'll do that next week. We've had so many successes come in just in the last week of students. One of our students, her 5-year-old son just yelled out one morning, "Mommy, you're walking again," which was so wild. So she was able to walk for a few hours in the morning without her cane or a walker. I think it was a cane. The students we work with, they're dealing with so much opposition, whether it's relationship, finances, sickness, all of this together, and they're just the leaders, the trailblazers, and the forward thinkers. That's what we call the wellness champions that we support in the Live Disease-Free plan. And it brings tears to our eyes when we hear their successes. So I think it would be good for us to do an update on the wellness champion successes, because that's what, I can share all the science with you, but if you can actually see that people are getting their life back and people are and what we're offering is not like a snake oil cure. What we're offering is teaching you how to restore enough balance so that you can get back to doing the things you love to do. The better you treat these parasites, the more effectively you treat them, then the more symptom improvement you have so you can recover. But the key is that you can still, to sterilize the body from these parasites. I don't know if that's totally possible, but once you get them down low enough, then you can manage them so that for the rest of your life, you never end up back in this position again. And that's how I have lived MS-free for over 30 years ago. It's not like I just recover. I treated them just like antibiotics for strep throat. You treat it, you're done in 2 weeks, you can go back to your normal life. I have been living this way, following a version of the Live Disease-Free diet, very close to it though, but following all the principles. And that's how I've been able to live over 30 years free of MS. And that's how we have students that have graduated at least 5 or 6, getting on 7 years now, and they are still living MS-free because they know how to take care of themselves. Yes, once or twice a year, they will knock back the bad microbes. And that is something that we should do just like we do with our dogs, our cats, our horses, etc. So this is a skill that we should learn in school, but unfortunately, we have not been taught this in school. What is your thoughts on cold-pressed, unfiltered black seed oil or lime juice? So black seed oil is antimicrobial. It depends what you have. It can be used in conjunction, but by itself, if you have chronic disease, it's not going to be enough for sure. But it has antimicrobial properties. So there's so many different herbs. There's oil of oregano, there's garlic, there's black seed, there's olive leaf extract, there's grapefruit seed extract. They're all wonderful herbs, but by themselves, they're not strong enough for you to treat a parasitic infestation. But it could be used in conjunction. And lime juice, that is going to be really high in vitamin C, which is good, but it's not going to be enough to treat. So even with the parasite, things like wormwood and cloves and black walnut, which are common parasite herbs that we find in health food stores, like combinations, including those, you can take them. and you may pass worms, but you'll still have the neurological symptoms. And we found also the big worms, they're not treating those also. But in combination, and also we have to be careful how we take them, because if we treat too aggressively, we can feel pretty lousy. We can be flatlined on the couch. We can have a strong Herx reaction, a strong die-off reaction. And so this is what we help students to do, is to get ready to treat, and then to treat in a very strategic manner where we start low and slow, introducing things one at a time, especially things they test well for through energy testing, and just cycling through. And we do that, and then also breaking up the biofilm that I told you about, really important. Hi, Marcus. What would be the best way to contact you? So the best way to contact me is, number one, just watch my masterclass training. As soon as I'm done, I will put the link in the description of this video. And after that, then once you've watched it, that talks about that's more specific about the infections, a whole bunch of case studies. Then if you're like, yes, I want to work with Pam, then you can click on a link, you fill out a form, and that form comes to our team. And then from there, if you are ready and you want to join, then we send you an email. If we feel that you're ready, we'll send you an email. You watch the coachathon that explains the academy in great detail, like all the steps we take. A lot of people are wondering, like, how do we get the parasite drugs? My doctor's not going to prescribe them, or I'm in a country where, doctors won't do this, but we will help you. This is what we work. In Canada, it's really tough. The United States, a little easier, but Australia, Canada, and New Zealand are the toughest countries. The UK is definitely easier. So they have more access to things, but we will help you, and that's what we do. So just watch my masterclass training, and then if you feel that that's what you want to do, become a wellness champion, fill out the form, and look for an email, congratulations email, and then you can watch the coachathon, book a time in my calendar, and some people just join as soon as they get that email. And I still will speak with you, because I speak with all our new students. I want to get to know you. I want to know about your health history, answer your questions, make that personal connection, because we're going to work together very closely for 90 days. How do you access prescription medications? So we help you find practitioners to prescribe. You are very welcome, Atal. Sorry. So you ended up in a walker in 3 weeks when you took the MS drugs. Ozone was a game changer. Yes, it is a game changer, absolutely. But we found that it isn't enough on its own. So it's awesome that you found it. That is one of the oxidizing agents, and we used to use that. So you can go to a practitioner, and you can do like a 10 pass, or you can do an IV ozone. Our students used to get the ozone generators and do rectal insufflations, but it's about a $2,000 investment for an ozone generator. So this is a lot cheaper. This is what the oxidizing agent that we use is about $50. It'll last for at least a couple of months. And the nice thing is you can introduce oxygen hourly into your blood, and also you can directly kill the pathogens in your entire large intestines. All right, a couple more questions and then I'm going to head out. And I apologize for the Facebook. Let's see here. You mentioned practitioners. So yes, so that's what we help you to do. It's difficult to find practitioners depending where you live. I'm so glad the ozone has helped you. You remember a doctor telling you that you had dysbiosis. Well, that is a very forward-thinking doctor. That's awesome. Pharmaceuticals, scary. That's probably why. Sorcery, yes, absolutely. Katie, reach out, or Callie, make sure to reach out to me, please. Just watch my masterclass training. You can also email info@livediseasefree.com. Hello, Marcus. So I would just email info@livediseasefree.com, and then prescribe to use in the program. Sorry, I don't know what that means. Let me see if there was another message from you above. You mentioned practitioners who would prescribe to use the treatments in the program. So the problem is that we help you to find a practitioner in your area. We help you to access the treatments. But if you have a doctor that is willing to work with you, usually they don't have a lot of skill in treating parasites. So that's why you need to understand what needs to be done. So you will know the dosages, you'll know how to take them safely. So what we're doing is we're teaching our doctors and working, but this is only in certain countries like the US for sure. Canada, it's more difficult. But in BC, there are naturopaths that can prescribe it. We help you access the doctors. How long can you hold ozone in a healthy person? Well, that I can't answer. That's a little bit of a loaded question. Like, it depends. Are you talking about a rectal encapsulation? Are you talking about blood, etc.? But I don't want to talk specifics on these calls or on these videos, because then people go, oh, Pam said to do this, and I don't know anything about anyone. All I know is that rectal encapsulations, if used properly, they can be really helpful. But what we're using is way cheaper. We can reach the entire large intestines, and then also using it orally. So you can dose it all day long. So you can increase the oxygen in your blood all day long. And it's so much cheaper. You're right, the doctor won't prescribe, and that's why I help you to find a doctor. And the oxidizing agents by themselves are not enough to recover. The herbs by themselves are not enough. We use a layering of treatments, and that's really what helps. So I am going to let you guys go. Thank you so much for joining me, and I will be back again next week. I may have to switch up doing a different thing with streaming. I'm not sure. I've got over 100 videos, and for some reason, the streaming platform I'm using is really acting up lately, but at least we didn't drop today. So I'll be back next week talking about another important topic. It'll either be carrying on with these infections, or I'll be talking about the wellness champion successes that have come in. I think that would be a really good topic, because we've had such amazing, we were like bawling, myself and Marissa, who also coaches, because it's just, we know these students, we know how much they're suffering, we know what they're going through, and to hear that they're starting to walk, they're starting to exercise, they're having happy tears instead of sad tears, it's just, that's why we do this work, and we're just honored to support the wellness champions in the Live Disease-Free plan. So if this is the first time that you found me, make sure to like and share and subscribe if you found this video helpful. Help us to get the word out. I mean, there's only one of me, and we need to change this. So please like, share, and subscribe. And if you subscribe, you'll know when the next training comes out. Go to our website, Live Disease Free, take that survey so that you can see what state of dysbiosis you are dealing with. And then that way you will get our newsletter, and you'll have access to all of the different resources, the science that I'm sharing with you, and share it with your doctor, share it with different, it doesn't even have to be a medical doctor, with chiropractors, with nurses, with any practitioner groups, MS groups, just share it so that way more and more people are starting to talk about this and moving into this direction. I honestly believe that I know that this is the answer. It is chronic infections are causing inflammation and disease. And when we treat them, that's the only way we can recover. And we just have to treat them effectively. The exciting thing is that we are learning that there is so much recovery we can have that we did not know was possible. We thought it was all permanent damage if we were in a wheelchair, that it were permanently, in a wheelchair, but that is not the case for a lot of people. Maybe most people. So we're learning as we go. Keep up the amazing work, and we will talk to you next week. Take care. Bye-bye for now.